Good morning, respected dignitaries and my colleagues. Today I am here to present my paper on left ventricular function in type 2 diabetes patients with microvascular complication. See, this diabetes mellitus is it creates a lot of issue, a lot of comorbidities among the Indian population especially. And among this, there are microvascular and macrovascular complications that are present. It is one of the cardiovascular disease caused by diabetes is one of the most leading cause of death in India, and we come across in the medical practice. Often left ventricular dysfunction is often underdiagnosed in type 2 diabetes mellitus, and my study aim was to assess the LV function in type 2 diabetes mellitus with correlation to the microvascular complications which arises. So this study, it was a cross-sectional observational study. 114 type 2 diabetes patients, all above 30 years, was inducted into the study. Exclusion criteria were hypertensive patients, non-cardiac valvular disease, cardiac arrhythmia patients, and other renal diseases were excluded. Data collected was among demographics, laboratory investigations, fundoscopy, and neuropathy test was done. Echocardiography for systolic and diastolic function was also performed. So the results we obtained is the mean age of the study population was around 62.5 years. Among that, 54% of the patients had diabetes for less than 10 years, and LV dysfunction was found out to be in 66% of this study population. Out of that, 21% have heart failure with a reduced ejection fraction, 11% have heart failure with a mildly reduced ejection fraction, and 34% of the patients had heart failure with a preserved ejection fraction. And retinopathy was found out to be in 68% of the study population, out of what 58% had non-progressive diabetic retinopathy, and 10% had progressive diabetic retinopathy. Nephropathy was found out to be in 53% of the study population, and neuropathy was present in 55% of the study population. Among the statistical results, after the statistical analysis, we found out that neuropathy is the neuropathy has the highest correlation of heart failure functions to the microvascular complication. So the underlying pathological mechanism is the chronic hypoglycemia. It will cause endothelial dysfunction, fibrosis, and ischemia. It will cause end organ damages, and retinopathy, nephropathy, and neuropathy are the markers of a cardiac disease. And there has been multiple studies regarding this topic earlier also, and this also confirms the same findings. So at the end, early echo screening can detect a dysfunction before overt heart failure, and this microvascular complications which can point when we have to start an echo evaluation of this patient. So in conclusion, LV dysfunction in diabetes mellitus patients with the microvascular complications, and routine cardiovascular screening should be inducted into the medical practice for patients with microvascular complication, especially when the patient have a neuropathic conditions. And early detection and intervention may reduce the morbidity and mortality and reduce the disease burden of a country.